Good morning, everyone. Thank you for joining us, the NASW-New York C.A.R.E.S Community Engagement Initiative, for the first event of the Spring 2026 Senior Series, Navigating Unsafe Discharge Situations, What Comes Next, with our guests, Assisted Living Locators. These events are designed to support elders and the social workers that serve them. My name is Angelique Imani Rodriguez, and I'm the Manager of Membership Engagement and Special Programs with NASW New York. I'm so happy to have you all here today. We appreciate your attendance and support of NASW New York chapter programming. Registration for the upcoming first annual NASW New York CE conference, where you can earn up to 7.5 CE contact hours, is still open for registration. There's also non-CE student sessions if you'd like to join us but don't need the CE contact hours. This is a hybrid format conference, so you can join either in person or online. You don't want to miss out. Registration closes on May 15th. We also have a robust calendar of C.A.R.E.S programming, including additional senior series events this week, which again are designed to support elders and the social workers that serve them. In May, we have 2 joint town halls with 1199 SEIU on pay equity and an incredible immigration series hosted by the NASW New York Immigration and Global Social Work Collective. Additionally, we're accepting submissions for the Spring-Summer 2026 issue of the NASW New York Currents newsletter until May 6th. This issue theme matches that of our conference, One New York, One Voice, Reimagining Social Work for a Just Future. We hope to see some submissions from all of you. Yes, all of you. Post-event, you'll receive an email that will share all of this information about what's upcoming at the chapter, as well as any resources or information provided by today's hosts. Please remember that by registering for any NASW New York events, you agree to abide by the NASW New York anti-harassment policy, the link of which I will drop in the chat for you shortly. Once again, thank you all for joining us today. If you have any questions about this event or any other NASW New York C.A.R.E.S community engagement events, I will drop my email in the chat for you shortly as well. Without further ado, let me introduce you to our hosts for today, Howard Horowitz and Michael Wolfson of Assisted Living Locators. Howard and Michael, whenever you're ready, please feel free to unmute and begin.
Thank you very much. And thank you all for joining today. Good morning. The topic for today is what to do when someone cannot return home. They've been in a hospital, perhaps they've had surgery, they are finishing a term at a rehab, and the question arises, where do they go next? Transition care. I want to introduce my business partner, Michael Wolfson, who's on with us, and also our intern and associate from Columbia School of Social Work, Hannah Wald, is on with us. So thank you both for joining, and they will participate a little bit later. But let's go right to the question. You have a patient. It is not safe for them to return home, at least as the home is currently configured. So the question arises, do you bring in home care? What type of home care? Do you consider assisted living? If so, what sort of situation would you be exploring for that? So broadly speaking, we work with assisted living primarily. As our name, Assisted Living Locators, would suggest. We help families to identify best fit assisted living situations. Assisted living can include independent living, it can include true assisted living, and it can include memory or dementia care, and we'll get into what each of those is in a moment. We do also work with home care companies, which is usually the broad category alternative to moving into an assisted living facility or community. That would be either bringing in home care, which can be non-medical or semi-medical assistance, things like helping a person with their ADLs, activities of daily life, getting dressed, medication management, and so forth. Or it can be RNs, where there's a higher acuity level. Someone may want to have actual registered nurses, perhaps even specialized ones for dementia, Parkinson's, etc., in their home. So those are two categories that refer to home care. And then there's also the companion option, which tends to be activities outside the home. Someone who comes as a companion might take the person shopping, might help them with grocery shopping, might help them to go to a doctor's appointment, or even just to walk in the park, or socialization, going to a movie or a show, or lunch. So let me turn over to Michael now, and Michael is the client-facing side of our firm, and he has a wealth of experience in dealing with family situations and situations of just this type, where you're not sure where to send the person and what the options are, and on short notice, which is most of what we work with. So, Michael, do you want to jump in?
Sure. Thank you, Howie. So just a brief bit on how I got into this role. I went through this long journey with my parents for over a decade. I'm an only child, and was looking especially for my father to find a community that could support his needs. He for a while was on a ventilator, and I didn't know that this support existed in the market. Frankly, it didn't to the degree it does today. But that's what motivated me to do what I'm doing now professionally, and find it very gratifying to help families in what's often a very challenging and at times even overwhelming prospect of finding long-term care for a loved one. So, and as Howie was saying, we I would say there's two scenarios really. I know the topic here is where to discharge a client you're working with when going home is really not a safe and secure option. Of course, an offshoot of that topic would be when maybe you have a client that's home, but continued home care is no longer viable. So I would lead by saying we take a very personalized approach to these relationships. It all starts with having an initial, very comprehensive intake with whether it be the family member. Often it's an adult child who's really managing care for their elder parent, or in some cases the elder him or herself. So really based on that, we come back with a short list of best fit options. And we're able to do that because we know all the communities very well. We have longstanding relationships with all the leading communities. So that's very helpful because right away we know who to contact. We're able to get timely access and in many cases favorable terms. So we leverage those relationships. So for example, if you had a client who was pending discharge from a rehab, what the way it would really work is I would visit on site and try to get as much information as possible. And for those time sensitive mandates, I'm able to secure and facilitate a safe transfer to the most appropriate facility or community, within that 24 to 48 hour time frame. And as far as the communities, so we cover all New York City, all 5 boroughs. And as you might imagine, that encompasses a pretty wide range of, price points and communities of all sorts. So it's certainly, this isn't a cookie cutter model. And part of what we bring to our clients is the insight what each community can offer, because there is a good deal of variance. For example, within assisted living, there's a category called enhanced care assisted living, which enables basically a higher level of care support. For example, they can do a 2-person assist for transferring, insulin management, complex wound care, nebulizer oxygen treatment. Those are all care that a standard assisted living typically does not offer. So there is a distinction just within the assisted living category. And then, for patients with different stages of dementia or some cases behavioral problems, we know those communities that can manage those needs. And frankly, even within that category, some are more challenging and complex than others. And again, we know the communities that are able to care for the ones that have a higher acuity needs. So really, I mean, if I could sort of summarize it without being too wordy, we try to find the best solution and make any transition really as seamless as possible. And that entails not just identifying the community, but we facilitate the physical move itself, and bring in other specialists as needed.
And so let me just interject there that in trying to think about the decision between home care, broadly speaking, home care, and assisted living, whatever category of assisted living, independent, assisted, or memory care, one of the key considerations that most of the families face and most of your patients face is what is the preferred thing is usually to stay at home. That's seemingly the easiest. It's the most familiar. It requires the least amount of effort from the outset, as many patients and families perceive it. It's not always the easier or less expensive or even the preferable choice, but it will usually be the instinct of the person to just head home. That is viable if a couple of conditions are met. First of all, the type of home they live in. If you're talking about a home with stairs, internal, external stairs, maybe it's in Manhattan, we're not talking mostly about freestanding homes, but if you're in the suburbs, you're talking about having all the things that a home would have. That's and the need to drive or the need to be able to get in and out of a taxi or an Uber. Those are considerations. In the city, is it a doorman building, not a doorman building? Are they going to be able to, is it an elevator building? Are they going to be able to function in the physical plant of the house? The second question that comes up is what sort of support network will they have in addition to having an aide or perhaps a nurse come and visit them for how many hours, how many days a week, but do they have a network of family, close friends that will be coming in and visiting them so that they're not isolated? One of the biggest issues and a deciding factor in moving into assisted living is the socialization dimension of that, the activities, the interaction with peers, even the interaction with much more staff in an assisted living building. So those are some key considerations. If you live in the sort of home or apartment that allows you to move around freely, you're not impeded by stairs. The doorways are big enough to use a wheelchair if that's needed, or even a walker. The hallways are not too narrow. And you have a good network of friends and family that are going to come over and help you in meaningful ways, not just call you once a week, then you may be a good candidate for bringing in home care and essentially trying to turn your home into an assisted living facility. If
Oh, we lost you, Howard. In the meantime, we do have a question in the chat while Howard gets his audio back. Does Assisted Living Locators serve Westchester as well? Thanks, Howard. Thanks for letting us know.
Yes. So to answer that more broadly, we do serve Westchester. We do serve Long Island. We do serve New Jersey. Our focus, Michael and I, in our shop, focus on the 5 boroughs of New York City and northern New Jersey. However, we are part of the Assisted Living Locators Network, which has about 160 affiliates throughout the United States. So we do cover, and as needed, we just involve whoever our affiliate is in a particular location. So we can place someone in Florida, for example. That's our most common out-of-state request, simply by involving one of our half a dozen affiliates in Florida. It could be Miami, it could be Palm Beach, it could be Naples, Florida, Tampa, wherever it might be. We just involve our affiliate there. And the same is true for Connecticut, the same is true for Westchester, and anywhere else in the US. And it's still free, or I couldn't tell if Michael had mentioned, our service is completely free to your patients or our clients. The reason for that is we're compensated by the assisted living building or community which we place in. And we work with all the different communities. We're not, we're agnostic as to brand. Is it Sunrise? Is it Atria? Is it Bristol? Doesn't matter to us. We work with all of them, and with local independent communities. We're just trying to find the best fit assisted living for the person.
One thing just to add, because I think it could be a very attractive feature, is we're able to find the communities that residents could be admitted as a respite, under respite care. So that's really a 30 or 60-day trial period, which often does convert to a long-term residency. And even in the context of a long-term, just sort of to be clear, all these communities, it's a month-to-month lease. So there's never a long-term lockup. It's not like you're purchasing an apartment. But for the respite, I mean, we get those most commonly if, for example, someone is in a rehab, being discharged, recovering from, say, a hip surgery, but really is not safe to go home yet. They can we can find the community that meets all the criteria where they can enter as a respite stay, and then they can either transition from home from there, or, as I say, in many cases they end up becoming a long-term resident because they're comfortable and they enjoy that environment.
And what that enables us to do to assist you is we can take someone from an emergency room who's coming out of an ER, or on one day's notice. We can figure out from their health profile, among other criteria, what would be an appropriate home for them. We can suggest 2 or 3, and those can be 30-day stays. And they're not required to stay 30 days, but they would be responsible for 1 month's rent, but they might stay 2 weeks. But there'd be no obligation beyond that. So those are things that do change on a weekly basis, because often what buildings are doing is, if they have a room that's furnished and not occupied, they will allow it to go into a respite or temporary stay, short-term stay pool. So we know where those short stay options are, which buildings they're in, who has them, and that changes every week. So we track that. And so if you have someone who on short notice cannot go home and cannot or chooses not to put home care in place immediately, or is interested in trying the assisted living option, that's something we can offer. And as a more general matter, there is no long-term lease in the buildings we work with. So these are all month to month. So you're only responsible for the next month's rent. You can cancel. So it's not as though someone has to sign, even if they were going and intentionally going to be a long-term resident. They would only be signing a month-to-month lease, not a 1 or 2 year lease.
We do have a question in the chat. Since you're compensated by the facilities, do you assist with Medicaid placements?
We are not legally permitted to work with Medicaid, unfortunately. And the reason for that is, by dint of the fact that we are free to our clients, we are paid. That's because we're paid by the communities we place in. A Medicaid facility or a more traditional, typically nursing home facility cannot use government funds to pay us. So they won't work with us, and we're not permitted to work with them. Where we can work with someone that is connected to a Medicaid scenario or a Medicaid facility is what's called a spend down. If someone does not currently qualify for Medicaid because they have some assets that are above the Medicaid uh, permissible asset base, but they are going to spend those assets over time, and it has to be a fairly short time frame. So over a number of months, it's usually not longer than a year. So you would expect 3 to 6 months more typically. If they're going to use their assets to pay the facility the monthly charge, and then will qualify for Medicaid in 3 or 6 months. We have buildings, and this is not a lot of them, but we know which buildings will work with us on that basis. They call that a spend down. But otherwise, this is all private pay.
Okay, so we have
And
another comment in the chat. Hello, my name is Clarissa, Director of Social Work at a skilled nursing facility in upstate New York, along with Stephanie, a social work discharge planner. Our question is this seminar pertaining to unsafe discharges in general, or is this pertaining more from the 5 city boroughs and local services? We're very excited to be a part of this educational opportunity.
no, it pertains to really anywhere in the U.S. This is a question that you face as a discharge planner, case manager in any hospital, SNF or rehab across the country. Our expertise in terms of knowing the different buildings, the different communities, and just knowing the city is New York specific, but what we're talking about here are options that are, broadly speaking, available everywhere in the United States. And as I mentioned, Assisted Living Locators is everywhere in the United States. We have 160 territories.
So just to follow up on that, so when we bring in our affiliate, that individual has the market expertise in that specific region, which is why we would collaborate with them, and they would be the boots on the ground typically. Although if it was nearby Westchester or even Long Island, there are cases where we do all the client work.
Okay. If there are any other additional questions, please feel free to unmute yourselves or to type it in the chat.
While you're thinking about questions, let me just add a couple of things that are a little bit longer term that we do for your patients. So first of all, if they do choose to move into one of the assisted living communities that we're showing them, there's a big hurdle to doing that. There's a move. We work with, and as needed, this is at your patient's request, we would be able to recommend a home organizer, what we call an estate liquidator, which would be someone that can deal with the contents of their apartment. Where's the furniture going to go? Some of it will be sold. So we have home organizers, estate liquidators. We can recommend movers. We can recommend real estate brokers if we're asked to. And these are all people. I mean, we have real estate brokers that have CSAs or that are focused on seniors. So we're always movers as well that tend to work a lot with the senior community. So we try to introduce people who are accustomed to the issues that come up when you're dealing with a senior and their family. We can introduce elder care attorneys. They may need a power of attorney in some instances. So we can introduce elder care attorneys. They're selling a home. They may need a financial planner. Maybe they didn't have one before. We have ones that tend to work with seniors. They may have insurance questions. We just had a Medicaid question. That's not typically what we can deal with except through the spend down that I mentioned. But we have many clients who have long-term care policies. These are privately written, like from New York Life, for example. We were on a call this morning with New York Life long-term care team, where we explain and review with the team what we can do for their long-term care insurance clients. So there are always questions. It's very typical for us to get a question along the lines of, my spouse, who's no longer with us, placed a long-term care or a life insurance policy 15 years ago. I have no idea what it covers. I don't know how to trigger it, how to get it started to help me pay for my assisted living. How do I do that? How much will I get per month? We'll take a look at that. We can also involve insurance experts so that they can tell someone, yes, this is what it'll cover. This is precisely what it will cover. This is how much you're eligible for. This is how you trigger starting that payment stream. And quite frankly, the insurance companies, at least some of them, are getting tougher as far as pressing the policyholder to follow exactly what the notice requirements are and some of the other requirements in order to trigger the policy. So that's becoming a bigger theme in the questions we get, and we're happy to involve those kinds of experts.
Right. And just if I, Howie, if I just make something clear, because it just to be crystal clear, long-term care policies pay for assisted living. So it pays for the rent of an assisted living. Medicare does not, and health insurance does not. So that's the distinction why long-term care is very advantageous for this type of situation.
I think we have another question in the chat from Susanna. Almost all of my clients receive Medicaid. Are you aware of any nonprofits or government agencies that consult people who receive Medicaid with finding assisted living or memory care?
You want to take that, Michael?
Sure. I mean, we do have resources that we refer patients to, clients to, who are Medicaid qualified, and the New York State Department of Health has the Assisted Living Program, ALP. So there are some Medicaid eligible assisted living communities, and of course we know them, and we would guide your clients accordingly.
And that being said, just to talk about a couple of other of the longer timelines that we consider, we think of ourselves as advisors. We're not looking to be transactional and just sort of place someone and be done. So we do follow up with them to see that the building is a good fit. So for example, we want to make sure that their dietary needs are being met. We want to make sure that what was promised to them by the building is actually being acted upon. And the longest time frame that we look at is a 12 to 24 month time frame. When we're even considering the buildings to recommend, we try to look at what we expect or can anticipate, and of course that's an imperfect science, but what we might anticipate their health needs to be a year from now or even 2 years from now. So two examples. If we have someone with a mobility issue, perhaps a minor mobility issue, they might walk with a cane, they might not. But if we see that, we're not going to recommend a building that doesn't favor walkers, wheelchairs, because that may develop over the coming years. There are some buildings, particularly some of the best buildings, that like high functioning residents. So we kind of know which buildings will be friendlier and more appropriate for someone that's developing perhaps a more severe mobility issue. Another issue is dementia or early stage dementia. Someone may not need to be in a memory care unit of one of these communities at the time we're working with them. But we certainly would not want someone with that kind of a developing issue to go to a building that did not have a memory care floor. Our goal is that they not have to move again, at least not out of that building, but rather that they simply would have to move into the memory care or dementia care unit, which is usually a separate floor of a community. So we would recommend buildings that have all of those capabilities. Not every building has independent, assisted, and memory care. So we would certainly try to have a building that had both assisted living and memory care in the example I just gave. And I don't know if anyone has any questions about the differences between those categories, but very briefly, independent living is a hotel. What do I mean? It has a restaurant. It may have room service to bring the food if you don't want to come to the dining room. It has linen and laundry service, maid service. It has transportation of some kind. It may be a shuttle, maybe a private car available to you. And it has amenities like a gym or a physical therapy space on premises, on site. That's independent living. Those are hotel amenities. Assisted living layers on top of those amenities. It layers on top medical or semi-medical, and I'll explain what I mean by that, but semi-medical services. We typically refer, I'm sure you do too, as ADLs, activities of daily life. This can include getting dressed, showering, bathing, medication management, toileting, any number of activities of daily living. An assisted living facility, unlike an independent living community, an assisted living will provide those additional services. And it can provide them either as included with the rent, or you can have what's called levels of care, which are, can be level 1 through 5. And depending on how many hours of service you need, or what sort of services you need, will determine the additional pricing associated with each level of care. So that's independent living, assisted living, and then we have memory care. And memory care is just another term for dementia care. That can include many different types of dementia in addition to Alzheimer's, and it can include various levels of stages of dementia care.
We've also partnered with some very helpful Alzheimer's or support groups, networks. So, when I have a client that's family managing dementia care for their loved one, often will bring in those resources, and they're wonderful. They're all very dedicated, and it really is a nice partnership. Because you need all the support you can get in that kind of situation.
Okay, we have some questions in the chat. Lori asks, can you discuss patients who have SMI, severe mental illness? It's often hard to place these patients with SMI. Is there any particular different protocol to place them?
Mike, you had
Sure.
some questions.
So the answer is yes, but I guess what I think of is I've had a number of clients I work with where there been either pretty significant behavioral issues, typically stemming from a condition of dementia, in which case I know there's 2 that are very well equipped and staffed to handle that type of situation, because of course their number one concern is having a safe environment, not just for that resident, but for all the residents. Now, if you're referring to something non-dementia related, that will be a challenging placement. And it's not typically what we do, but really, our approach is we'll find where a solution could lie. So it's not like we'll pass the buck on it. But most of those cases really are dementia related because we're dealing with an elder community. I hope that answers the question.
Yeah, she said non-dementia related. She clarified her ask.
Yeah, as I say, it's not something that we typically do. I have had actually, I think, 2 where it's been someone in their 50s that have had, severe mental disabilities or whatnot. And I'm thinking of one in particular where they said as long as there's no risk to the resident or any other residents, they would accept that profile. But it is, it would be a more challenging placement. But there are
It's dependent on the rules of the building, on the policy of the building. And I will say that the majority of the assisted living buildings simply will, for their own safety and security policies, not be very open to accepting that. But there are a handful that will. You may have to place someone at a greater distance, for example, than you might otherwise have been considering. So in other words, you may have to go outside of the city, et cetera. You may have to, go, greater distance from the original home in order to find someone that can accept that within the assisted living universe.
Yeah. And one thing, just a quick add on, the way the kind of the admissions process works is they do an assessment of each potential resident to determine whether that individual is suitable for their community, and also to formulate a customized care plan. And usually that's done if the patient is, at the rehab or hospital. They'll come and do that on the premises. And when for those cases where that's not the case, then they can do it at their facility. And it's usually the nursing director that oversees that.
Okay, we do have about 20 minutes left in the program. If we have any questions, Lori responds and says, yes, it's hard. I have patients who have diagnosis of bipolar and schizophrenia who are aging with medical issues, but most facilities see the diagnosis and don't want to take them on.
Yeah, and that's where you might also be looking at a nursing home scenario. We haven't really talked much about that because we can't do the Medicaid piece, and nursing homes, while not exclusively Medicaid funded, are in many instances majority or overwhelming majority is Medicaid. But a nursing home exists just as a category. We talked about the categories of assisted living. A nursing home exists for the highest acuity patients. So when you have someone who really falls beyond the capabilities or the willingness of the assisted living universe to deal with, you're probably talking about someone who is a candidate for a nursing home, if they're of that age. The other thing Michael mentioned, assessment for the social workers in hospitals or rehabs. Just so you know, the assisted living communities will send their nurse to your facility, to your hospital or SNF to do the assessment, and they're pretty quick about that. I mean, they'll send someone the next day. So that's important for you to know, so that you not feel that going the assisted living route or any other route is going to be a very extended time frame and you need to discharge the person. I know, have worked, and Michael particularly, on very short notice and with very constrained timelines, and gotten multiple assisted living communities to do their assessments and to make decisions about what the assessment is, what the needs are, what the pricing is going to be. They'll do that pretty quickly, and they'll come to you.
Hannah, I believe you had your hand raised. If you want to ask a question, please feel free to unmute.
Hi, can you hear me?
Yes, we can hear you.
Okay, so following up on that, I just wanted to confirm, because I know that I had.
Oh, actually, I'm sorry to interrupt, Hannah. You're a little low. Can you repeat that for us?
Can you hear me now?
Yes, we can.
Yes,
much clearer.
much
Thank
better.
you.
Okay, so just following up on the talking point about clients with severe mental illnesses not related to dementia, so schizophrenia, bipolar, those kinds of diagnoses. I know that we have gone touring with on skilled nursing facilities with clients. So if and we have helped them with those locations. So if a client was in need of that sort of support with mental health or other physical health issues that maybe assisted living can't really accommodate to, could you just further explain what that process is like?
So we do work closely, and I think you're referring to the skilled nursing and rehab centers, especially several of the kind of well-known institutions here in the city. And so those are facilities, as you know, Howie had mentioned, that would be more suitable for an individual with severe mental disabilities. And so even though that's not the assisted living model, you know, they're very much a part of the ecosystem here. So, you know, we do work closely with them. So that would be a pathway to help someone in that position.
So I guess we could take more questions, but I guess just to pause here and try to recap what we've said up to now. Basically, we're here to help. There are resources available. So we are free. We are to your patients. We are quick. We can assist anywhere in the United States. Our focus is the New York area, but we're, as we said, all over the U.S. We help people make a better decision. We do work with home care companies as well. So if someone's not sure, we can, or in the end decides that they want to stay at home and just equip their home with home care professionals and set their home up in such a way that it's workable and livable for them and safe. We can recommend some of the best home care companies. You know, one of the issues comes up with the home care companies. There are not a lot of people who do what we do, which is the assisted living advisory work. There are 100 plus home care companies in Manhattan alone. So it's sometimes hard to figure out, you know, which one. We know the better ones. We work in partnership with them. We don't seek to compete with them. We refer to each other, and we work in partnership and collaborate with them. So we can help you to navigate even the home care piece as well. And we're quick. You know, we'll respond. We have a 24/7 intake line. That's the number you see on our materials, 212-653-0152. That's a 24/7 number. You can call New Year's Eve at 2 a.m. You'll get a live human being on the second ring at the most, and they will do the intake. They'll get the health profile, the budget, desired location, and social cultural interests. And that gives us enough to work with. And within 24 hours, we will be back to the client, we'll be back to you with 2 or 3 or 4 recommendations, depending on the parameters, but always several, which are going to fit all of those criteria, the budget, the health profile, the social interests, and the desired location, maybe to be near their doctors, near their children, whatever it might be. And so our turnaround time is pretty quick. And the truth is, we love what we do. We view our work as a service to the community, to the healthcare community, to the senior community, and nobody ever gets a bill from us other than the buildings themselves. So that's never a concern for the families. And it's joyful work, and we're happy to do it. We're based on the Upper East Side, which is obviously near a lot of the major hospitals and rehabs in New York. But we have expertise across the entire 5 boroughs and northern New Jersey ourselves, and can involve our affiliates anytime we need to.
So, folks, Michael just dropped his direct contact in the chat for you all. This information, any resources that were dropped in the chat, and further information around assisted living locators will be sent in the post-event email that will go out to all of our attendees, including the recording of this event. Feel free to drop any questions in the chat or raise your hand. You can unmute and speak directly to our host today. We do have some time left. I'll give it a minute or so. If we don't hear any questions, then I'll give you guys back some time for the day. Feel free to drop it again once in the chat or to raise your hand and unmute.
And thank you all for everything that you do for your patients and for your healthcare systems. It's really extraordinary work. I mean, we're in a phase as a society with an aging population where this is only increasing. The need for it is increasing. The demands on the system are increasing, and we don't underestimate for a moment the tremendous value and good deed that you do on a daily basis all year round. So we appreciate you.
Beautiful. Thank you, Howard. Okay, we'll give it just another minute. If you want to drop a question in the chat or raise your hand and unmute, we welcome you to do so.
And just to add, I mean, if anyone on the call has any thoughts or questions, after the call ends, please feel free to just reach out to me directly. I'm always happy to have a conversation with you and perhaps a client, even if it's just a question of introductory, informational, whatever the context might be. We're very, welcome to engage your community.
Brilliant. Helpful information. We're getting some good feedback in the chat, guys. We'll give it just until 11:48. Thank you so much. Another thank you in the chat from Nigel. Thank you, Ms. Jackson.
And thank you, Angelique, for all of this.
Of course. Of course. We do have a question. What would you say are the average monthly costs of assisted living in the region you service?
Okay, so that's an excellent question. So let's talk some numbers here. The range, to put it out there, is about $6,000-7,000 at the lower end of the price point to $35,000. That's per month, not per year. So what would that mean? 6,000 or 7,000 is going to be, any facility we work with is somewhere where I would put my own parents. If that were the case, we don't work with anyone that is not a beautiful facility, and I mean that without hyperbole. But location does drive price. Service does drive price. So in the boroughs of, say, Queens, which would be Forest Hills or Rego Park, Kew Gardens, lovely leafy neighborhoods, very safe neighborhoods. You can see something for $6,000. If you're in a 2-bedroom in the very top building in Manhattan, you're going to be asked for $35,000 a month. And that's where, in those types of buildings, more than half, in some cases, 2/3 of the folks are paying with long-term care insurance that we mentioned. Half to 2/3 are using their long-term care insurance policies. These are privately written policies, sometimes part of their life insurance policy, and that's how they're paying for some of this. There are many other ways to pay for it, obviously savings, but there are a whole host of, there are annuities that are available, single premium annuities that you can get quickly, that is a way for you to develop an income stream to pay for this. There are reverse mortgages that you may have heard of. There are a number of different things. There are veterans discounts. There and we know the layouts. I'll give you an example. We were able to place someone in a shared situation in dementia care. Dementia care is the highest ratio of staff to patient, so it's the most expensive. Shared simply meant, in that context, and it was a 30% savings. They had their own bedroom with a lock on the door, their own completely private bedroom, but they shared a common area and a bathroom. So that we were able to knock down the price a great deal, and in a building that had that option. Otherwise, they would have had to pay quite a bit more to get their own private studio in a memory care unit in Manhattan. So the other thing to mention, and we're talking New York City here, the national average, just for reference, is about $5,000. The national average for assisted living anywhere in the U.S. is about $5,000 per month. Our typical in Manhattan, we tend to skew higher, so we're typically looking at something between $10,000 and $20,000 per month. But what do you get with that? It's all inclusive. So in a way, it's like a cruise ship. You get 3 meals a day. You get a maid service. You get laundry service. You get transportation. So if you think about someone who is living in an apartment, for example, on the Upper East Side of Manhattan, and they're paying maintenance and they're paying all the expenses associated with maintaining that apartment, and groceries or restaurants or taxis or Ubers, perhaps a housekeeper. You add all those expenses up, and that's what you have to compare the 10 to 20,000 with in assisted living, because you get all of that included in the buildings that we show in assisted living. So it isn't cheap in Manhattan. And as I said, if you go to Brooklyn, Queens, Riverdale, the Bronx, as examples, you can Staten Island, you can be talking about, half of that, something like $5,000, $6,000, $7,000. What you may have there is levels of care. So that only includes the rent. And if you need someone to help you get dressed and help you with medication management and so forth, you have to pay an additional fee. So it brings it up to $6,000, $7,000 on the lower end of the spectrum. So I hope that answers the question. And obviously, if you go to the suburbs, again, we cover New Jersey. That gives us a range of pricing options of lower pricing points. Same with going to any of the other suburbs around the tri-state area. The only thing I'll add to that one, just one quick note, if someone has a home aide, even at the higher price point assisted living, they'll probably save money, because the cost of maintaining their apartment and their lifestyle of groceries, food, restaurants, taxi, Uber, etc. You add that up and you compare, and if you've got a home aide on top of that, which you're paying thousands of dollars a month to, and especially if you need it, 7 days a week or 24/7, but even if it's 40 hours a week, you're paying a lot of money for the home aide. You add that with the cost of maintaining your home, and then you compare it with assisted living, you very well may save money if you've got a home aide. And it will be certainly much easier and less isolated to be in a community with activities and entertainment, and a peer group, and of course all of the things that are included, the meals and the housekeeping services.
Okay, so we have just a little over 5 minutes. Wanted to thank you, Howard and Michael, and Assisted Living Locators for presenting today. And for everyone who asked questions and participated in the event. This is what the Senior Series is about, is providing resources and information to folks in elder care and who work with our elders. So once again, thank you all for being here. I appreciate you so much. Michael and Howard, once again, thank you again. I appreciate you. All of the resources that were dropped in the chat, including Michael's information, will be sent to exclusively attendees, and as well as the recording, and any other resources or information they send our way will be included in that post-event email. Once again, we thank you for supporting NASW-New York CARES community engagement events, and we'll see you soon.
Thank you all very much. Thank you.
Thank you so much.
Have a good week.